Hello, doctor. What are the symptoms of shingles? How is it transmitted? Can I get it twice or not? How do I treat it if I get it? And is it contagious or not? Let's take the story from the beginning. The virus that causes shingles is called Varicella zoster virus. This virus habit infects most of us when we are children and causes an illness known as chickenpox. Chickenpox has symptoms similar to a cold, along with a rash of water-filled blisters spread all over the body, causing a severe itching sensation. In most children, it heals on its own even without medication. We only provide medication to address the symptoms. What happens is that this virus goes and hides in the nerve cells of the spinal cord, and at some point in our lives, when our immunity decreases, it becomes active and starts to emerge from its hiding place, causing inflammation in one of the nerves that supply the body. That's why most of the time it affects an area that follows the path of the nerve. For example, if it is in the chest or back, follows the nerve path, or in the abdomen, it can appear anywhere. It can even reach the head, and sometimes it appears near the eye or the abdomen. When this inflammation occurs, what does the patient feel? Or when this virus moves and reaches a certain area in the nerves, the patient feels or comes and says, "I have very severe pain or a burning sensation in this area." On the first day or two, we look at the skin and there might not be any changes. After 2 or 3 days, the same rash that occurred before starts to appear. During the days of chickenpox, it happens now that you find water-filled blisters on the area the patient was pointing to and saying there was a burning sensation, which is why they called it shingles, because it follows the nerve path resembling its entire course. But most of the time, it affects half of the area and the patient's sensation of burning. That's why they called it shingles. So, doctor, is this something dangerous? God protects us, and most of the time it doesn't cause any serious problems at all. However, it is preferable to start treatment within the first 72 hours to avoid complications. So what is the treatment we give in such cases? We administer an antiviral called acyclovir at a dose of 800 milligrams 5 times a day for adults. Of course, for people who don't have immunity issues. As for children, doctor, if they get it, the dose is calculated based on weight, and I don't recommend anyone to do it on their own. You must consult a doctor to calculate it. So, what other medications are there? We give painkillers to reduce the patient's sensation of burning or the pain they are complaining about. A patient describes a sensation of burning and pain, so we give them something to relieve that. Outside the Arab countries, they sometimes prescribe opioid painkillers, which are very, very strong. However, in the Arab countries, we are cautious about using them or their misuse, so we prescribe slightly simpler painkillers. So let's see what happens if this patient doesn't get treated initially, doesn't start treatment on time early within the first 72 hours. The likelihood of complications is somewhat higher. So what are the complications that might occur? Sometimes something happens that we call post-neuralgia. What does that mean? What I just said? Acute nerve inflammation following a shingles infection. What are its symptoms, doctor? The patient might suffer for months to years from burning and severe pain in the area where the infection was. Even when the rash disappears, regular and simple painkillers start to have no effect, and the patient continues to suffer from this sensation very intensely. Sometimes it forces us to increase medications that work on nerve pain, like gabapentin and pregabalin, and sometimes we also give antidepressants to start working on the sensation of pain. The incidence of complications is very low, so no one should stop taking it. This rate is very low. Most people recover from it without any lasting effects or complications, except for people who get the infection near the eye or ear. We are more cautious with them, and their treatment is different because we are concerned about complications that might permanently affect the eye or ear. Their treatment, which I was about to tell you about earlier, is administered intravenously, and they are treated in the hospital, not at home or in health centers. So, can I get infected with shingles twice? Unfortunately, the answer is yes. Why, doctor? Because this virus, as we mentioned, was hiding in the nerves, and it waits and takes advantage of your immunity dropping to cause its inflammation. The percentage of people who have had it twice is small, not large, but there have been recorded cases of shingles occurring more than once in the same person. So, is shingles contagious, doctor? Let me tell you something. If you had chickenpox in the past, you don't need to be afraid of it. Why is that? Because, as we said, it's caused by the virus that gave you chickenpox in the past. So if you had chickenpox, you actually have the same virus, and it's hiding in your nervous system. So you're not worried about it. Who should we be concerned about then? People whose medical history does not show any record of chickenpox infection, or who have not received the chickenpox vaccine. We are concerned that they might contract this virus, and when they get this virus, it won't cause them shingles. Now, if they catch something, it will be chickenpox. So how is the infection transmitted? Through contact. In most recorded cases, it's through contact, where you touch the area with the problem or the rash of shingles, or the patient touches that area and then touches things that you handle. Or if you touched his hand or handled the clothes he was wearing that touched the shingles area. The fluid that oozes from the blisters on the shingles area is what leads to the significant spread of the infection. Therefore, we ask all patients to keep the shingles area covered to greatly reduce the chance of transmission. Some studies have recorded that if a part of these viruses falls from the area, on the skin and moves through the air or spreads through the air. It can be transmitted to other people present in the same place, causing them to catch the infection, but contact and touch are more common. That's why we emphasize to the shingles patient that the affected area should always be covered to prevent the risk of infecting others who do not have the virus in their bodies. So doctor, how can I protect myself from it? I had chickenpox a long time ago, and I want to protect myself from shingles and avoid getting it. I will tell you that there is now a vaccine available in all countries. This vaccine is administered in 2 doses, especially for the elderly and those with chronic diseases, to protect them from getting shingles. The chance of immunity that this vaccine builds is over 70%, preventing infection 100%. No, it does not prevent it. But for those who have taken this vaccine, when they do get shingles, the symptoms are very mild, and more than 70% of those who receive the vaccine do not get shingles at all. So, is it useful to give it to young people or those who are under 50 or 55? Yes, but we choose people who have immune system issues or are undergoing chemotherapy or biological treatments that affect their immunity. They have autoimmune diseases and are given medications that suppress their immunity. They have type 1 or type 2 diabetes that is uncontrolled, and thus it affects their immunity. All of these individuals can start early and receive the vaccine, which consists of 2 doses. The interval between the doses is the first dose. The second is taken 2 to 6 months later. In some rare cases, we can shorten the interval to 1 month. The vaccine is provided for free in some countries. In other countries, it is available for a fee, and it is not very cheap. The price is considered a bit high, but it is available and accessible. So, does the answer to my question come more than once or not? It was yes. We learned about the story of shingles. We learned about its symptoms, treatment, and how the infection spreads. Be mindful of the health of anyone who develops a skin rash. Don't take it lightly if anyone feels tingling or burning in any part of their body. Don't take it lightly. Go to your doctor or call them so that if it turns out to be shingles, you can start treatment early. Avoid any future problems or complications from it. I hope this video was helpful to you. If you found this video useful, please subscribe to the channel if you haven't already. And if you think someone else could benefit from the information, share it or mention them. And please like the video if you enjoyed it.